Good evening and welcome to tonight's webinar on telehealth. Is it right for me? My name is Josh Dines and I'm a sports medicine orthopedic surgeon, as well as Vice Chair of Community Engagement at Hospital for Special Surgery. On tonight's webinar, we're going to talk about navigating telehealth, really what it is and what it can offer, particularly with regards to musculoskeletal issues. We're very fortunate to have some great guests tonight, Doctors Mark Drakos, Joel Press, and Jay Mizuta, who's a physical therapist. I'm going to give a brief introduction, and then we'll start a conversational session about what is telehealth. So Mark Drakos is an orthopedic surgeon who specializes in disorders of the foot and ankle, as well as sports medicine injuries. He serves as the medical director for the HSS Long Island location, as well as the fellowship director for the foot and ankle service. Dr. Joel Press is the chairman of the Department of Physiatry at HSS, and he focuses his clinical and academic work on managing spine and sports-related injuries. He's really become a thought leader in the field of telemedicine. Prior to joining HSS, he was an attending physician in Chicago at the Rehab Institute of Chicago, where he founded and directed the spine and sports medicine rehab centers. Finally, and last but definitely not least, Jay Mizuta is an orthopedic certified specialist in physical therapy. He currently works at the HSS Westchester location with a focus on helping patients with knee injuries and conditions. So thank you guys for being here tonight. I know we've got a lot of guests sort of watching and very interested in telehealth, and you can't kind of open a newspaper or see an ad right now without hearing about telehealth. So I think this is a very timely topic. Let's start though, just to kind of lay some groundwork, because I think it is everywhere, and it almost means a lot of different things to different people. Joel, when we talk about it with regards to sort of treating musculoskeletal injuries, what is telehealth? How do you define it?
I think the way to look at telehealth is how do we provide care for patients in a remote setting or in a virtual way? It's really the care that we're trying to provide. And that care is really the evaluation as best that you can, and also even trying to come up with a plan and idea and even doing some treatment. And you'll hear Jay talk more about some of the different treatment options we can do. Obviously with the coronavirus and everything, we sped up what we were doing in terms of this kind of virtual care and telemedicine. We were starting to do it, and we went from kind of 0 to 60 in about 5 seconds because we had to. And the experiences that we've gotten with it, we've realized that there's really a lot of great opportunities to kind of meet people where they are. When you're stuck at home because of the coronavirus, this was a great way to be able to say, look, we can still do an evaluation, we can still try to figure out what's going on and use our expertise, and then actually working with Jay and people like that is how do we actually provide some care too?
That's a great point. Mark, is this, obviously coronavirus sort of sped up the implementation of telehealth. Do you think that, and obviously we're not out of the woods by any stretch of the imagination, is telehealth just kind of a temporary sort of fad to get us through coronavirus, or is this something that's here to stay?
I absolutely believe it's here to stay. When I think about office visits, I think, what is the best way to convey and transfer information basically from the patient to the doctor and then the doctor back to the patient. And so when I think of an office visit, it's kind of broken down into 3 parts. One is the history, where a patient is telling you what's going on. 2 is the physical, where you kind of evaluate the patient. And the last part is assessing for what the diagnosis is and recommending a treatment. And 2 of those 3 parts are just verbal. It's listening and communicating. There's an old saying, if you want to know what's wrong, just listen to the patient. And that can be done like right now for me to you over the internet, or it can be done in person. And to Joel's point, because of coronavirus has expedited the need for this, and people have concerns about traveling. But the biggest advantage is convenience. And if you can establish those things without having to take a half a day off work, trek into the city, can't tell you how many people are ticked off of parking or all these other things, trying to get into the city, and you can do that effectively, then I think it's such a huge advantage. The one kind of X factor is the physical exam. And, I know Jay's going to talk about, the challenges and, how effective physical therapy has been over the internet. But there are definitely some things you can get from the patient just by observing them. For me, just watching patients walk, watching them try to go through a range of motion online, you can get some of that information you need to make an accurate diagnosis. So the biggest thing about telehealth is convenience. Instead of going to a waiting room in some doctor's office. You can be, waiting room on the beach for all intents and purposes. And I think the convenience is really going to be appealing to people, particularly as there are concerns about going into certain environments for health reasons, or just because of what a challenge it would be to, one's day.
No, that's a great point. And Jay, I'm not going to leave you out, but I want to just get back to Joel for a second. Are there particular visits, are some things very conducive to telehealth and others not? Is this just for an initial evaluation during COVID, or can it be used almost across the board?
I think there's lots of great opportunities and different types of cases that you can use it for. I think we have to be a little bit careful and understand that it's not going to replace going to your doctor and seeing your doctor and having them actually evaluate you for everything. And there are some things, and I think the things that we could think about are really a very severe trauma, or you really twisted your knee and you can barely put weight on it. Those are the type of visits that might not be appropriate for telehealth or virtual care. Those are the ones that you probably do need to see somebody because there's probably something a little bit more serious going on. So when you have those type of things that are a little bit more serious, or you were in an accident or had a trauma, those probably need to see the doctor. So telehealth is not perfect for everybody and everything. And I think, as Mark was talking about, the real benefit's going to be when you know the patient, you've seen them, and you're having them come back for a recheck and things are actually going pretty well, but they have a few questions, or you want to go over an imaging study with them where you can do the talking more is more important at that point. Then you save a lot of time, energy, travel, and everything else that we said. So it's not perfect for everything, but a lot of things you can share a lot of the information. You can see a lot of things. One of the advantages that we found is it's interesting that when you actually see somebody in their own home, it's very helpful, especially they're talking about their neck pain and then they're sitting there at their kitchen table and leaning forward like this. Well, this is how I'm typing. You might not have seen that when they came into the office because they're sitting there in your office. So you can actually pick up some things when you actually see people in their native environment.
That's a great point. Jay, I just asked Joel, are there things that are not appropriate? Physical therapy, a patient's perspective, it's so hands-on. How do you think, that clearly there's a role for telehealth as it pertains to physical therapy? Or is that something where you still need to see the patients in person every time?
So I think there are most certainly conditions that are conducive more towards the manual approach. But when you look at sort of the basics of physical therapy and what we do and what we're good at, I would consider physical therapists as sort of experts in sort of movement and mechanics. And so when we're looking at sort of movement, I think having an individual, as Dr. Press was saying, in their home environment, I think we have, an advantage that we aren't normally used to. A lot of times patients will come in with pain with, I have trouble sitting, I have trouble standing. Okay, it's essentially a squat. And, having them in their home, you get this advantage of seeing how they function and interact in their home. So I think most certainly there's conditions that are and there is a place for physical therapy coming from a telehealth type of approach.
It's interesting, and I think it applies to kind of all of our practices. The HSS does a great job, and you in particular, Jay, and your colleagues, of really spending a lot of time with patients. But I had concerns about physical therapy early in the COVID days, sending patients, because you really do think that something's going to be missed. I was amazed how many patients really like it because they're getting, it's one-on-one attention. So it's not you with a couple of other patients, that you're sort of supervising tangentially. This is you with that person for half hour, 45 minutes, an hour, whatever the time is, getting your undivided attention. So I think obviously there's some trade-offs, but there are a lot of positives to be said about it as well that get lost in person.
Oh, absolutely. I think that they're like as Dr. Dracos was saying with the subjective stuff, just getting to know the patient and how they interact with everything around them, I think has been a big advantage with the telehealth. So
that's great. Mark, I know both you and Joel have spent a lot of time on this, and it's really helped other doctors at HSS really kind of talking to patients or preparing sort of stuff to get patients prepared for their telehealth visit, because there clearly, there can be some things that don't run smoothly if it's not thought about in advance. And I think we as an institution have been very thoughtful about it to make the visits go seamlessly. How do you counsel your patients in terms of preparing for a telehealth visit? Is it different than what you tell them to do in person?
Yeah, I think that preparation is key. So we send a video out to all of our telehealth patients, just showing them what they're going to be expecting, because kind of as you guys alluded to before, it's a big black box, and it may mean different things to different people. For me, what I try to do on every telehealth visit is I want to obviously hear the patient's story, but I want to do as thorough a physical exam as I can with the limitations, and then ultimately come up with an assessment and plan. And so we send them a video, and there are certain patients that are more, technologically savvy than others, right? So some patients, it'll take them 30 seconds to get all set up and everything's very easy. Other patients, it takes a half hour to get the video on, right? Or, the first thing you'll say is, I can see you, but I can't hear you. If I've said that once, I must have said that 20 times. But once everything gets up and running, it's great, because then you can interact. And I do think the video adds this other component to it. The other thing that the technology has allowed us to do is that if we are viewing imaging, you can share your screen with the patient. So normally patients would call with a phone call to just get the results. And now with a telehealth visit, you not only can talk them through it, but you can actually show them on their imaging, whether it be an MRI, CAT scan, what have you, what's going on. And so I think there's so many advantages to it. And once people get the logistical work of how to log on and how to position the screen, it makes it a lot easier for the visit to go well. So for us, like for foot and ankle stuff, I usually want to see the patient walk. So I need to have them position the camera so I can see kind of a profile of the patient going across the room. So we send them a video ahead of time saying how the video should be on, a chair and how far away you should be. And I think, it's enabled the visit to go much more smoothly and spend less time dealing with the kind of technical problems that develop, and just focusing on getting the information, seeing the exam, and discussing the case.
That's a great point. And, it's obvious to us because we know it's it's a loaded question. But Joel, there are some patients who are concerned, or concern might not be the word, just don't realize that they think that it's sort of a telehealth visit is sort of just the jumping off point in the negotiation, where you give them some information, but you can't make a diagnosis, you can't prescribe treatment because you're not seeing them in person. Has that been your experience, or do you think that a lot of the time you can, almost treat the patient completely?
I think there's a lot of situations where you can, and I think the stuff that Mark and a lot of his colleagues have done, we've kind of stolen the same thing, because that preparation and having the ability to see everything, and especially with spine, we see patients with back pain. If I can watch them walk, I can watch them bend forward, bend backwards, see how far they can go, get them on the floor, try different positions, and even doing things to look at your strength, going up on your tiptoes, things like that. You can get a tremendous amount of information, and then we've kind of learned little tricks of other ways to do it, even with shoulder examinations, where you put a certain number of cans in a sack and have them raise it up and down, and you can start to see if there's levels of weakness there. So there's a lot of ways that you can do a little workaround to actually get some of those physical exam things that you would normally get in the exam with the patient. But that preparation and that setup of the cameras and everything is critically important for that.
That's good. Jay, I imagine that is kind of same for you. Like, do you guys, tell patients, almost have them prepare a kit, like a home exercise kit, so you can guide them through some strengthening exercises and such, or do you give that to them, or tell them what to kind of find around their house or buy?
Right. So, I think a lot of the times when people think of PT, they think of these like big, grandiose exercises and motions, right? And I think it's sometimes a misconception. A lot of times individuals will have issues with those big, grandiose movements, and it's the very simple motions that tend to be more problematic. And with simple motions, you need sort of very simple materials. Something, again, like a chair for a box squat, or like if you have stairs in your house. A lot of times when we're looking at even higher level individuals who want to do like a single leg squat, which is a pistol squat, very high level, a lot of times we'll have them start with like a step, right? Doing little step downs. Essentially, it's a very similar motion that can get them towards the more complex motion. So as far as specialized equipment or things that you really need, a lot of the things just around the house, you'll actually find just variations here in the clinic. Again, like if we're looking for weights and resistance, something like a water bottle, a 16-ounce water bottle, weighs about a pound. Or with the whole COVID epidemic and people sort of at home, empty wine bottles. Again, they weigh about a pound. So, I mean, there are plenty of things at home that individuals can use for sort of body weight training.
There are definitely no full wine bottles during COVID. So that's
definitely not. Right.
No, that's great. That's great stuff. And are you able to kind of, monitor people's form and stuff like that during these virtual visits?
Yeah. So again, because a lot of the motions that we're kind of doing, they're fairly simple. It's fairly easy to sort of pick out deviations. And one of the advantages of the telehealth format is they get the feedback directly on their screen in regards to seeing the reflection. So it takes at times a lot less sort of education regarding like where these deviations are occurring, because they're able to see it. And then, if we need them just kind of turn, right, go ahead and turn, and I'm going to actually record my screen and I'm going to show it back to you. And so they're able to see the deviations, they're able to, and we can talk about it, and they tend to actually really enjoy that. So,
I think that's a great point, because I think, clearly some things are missing from when you can't do an in-person visit because you can't put your hands on the patient. But I think technology provides some advantages to, potentially make other things a lot better. I think that's a great example. I'm a terrible golfer, but, taking lessons, when they could show it to you on the camera, it's easier to correct than somebody sort of trying to talk you through it or guide you. So I think, using technology, there are some ways where we can make these visits better or more productive for the patient.
Right.
Which is great. One thing that also comes up, again, because we sort of take for granted, we have a good understanding of it. If somebody comes and sees you, quote, virtually, are they still able to get, pre-COVID, they'd have to come in the office, after you made your diagnosis, you'd hand them a paper prescription for physical therapy, maybe for an anti-inflammatory, things of that nature. Can you still do that despite not kind of seeing them in person?
Sure. So a telehealth visit has a lot of the same advantages as a regular visit. So you establish patient care at that point, and you can write prescriptions. And certainly there's an individual comfort level with what types of prescriptions you write. But if you feel confident in your diagnosis, you'll write prescriptions for physical therapy. Very often, we'll use this as a stepping stone for kind of the next level of treatment, whether you need advanced imaging. So there's plenty of telehealth visits where I know the patient's going to need an MRI, and we order the MRI via telehealth. And you can do a lot of the management remotely. For kind of basic things, like the muscle strains that we'll see, tendinitis, those types of things that, have a good natural history in terms of improving. You can make the diagnosis via telehealth, recommend physical therapy, and then follow up, either on an as-needed basis or via telehealth. Where I tell you this has actually really changed us is with our post-operative care. So you can do a lot of post-operative visits via telehealth. A lot of times patients would call and say, well, I'm not sure if this looks right, or, they need to come in, and doing a telehealth visit, you can actually get a really good eye on what's going on with the incisions, what's going on with the patient, what it looks like. And that's really been helpful as well. And then you can recommend treatment, whether it be, whether a patient does need to come in, or whether they can get oral antibiotics, or whether they just need dry dressings. So you are able to actually make treatments via the telehealth, as it is an establishment of patient care.
You brought up another sort of potential use. I think the opportunity cost savings here is huge. So just like you mentioned, earlier you mentioned, not having to travel across town and pay for parking, and a 5-minute visit becomes 3 hours of somebody's life. But also just for peace of mind, being able to kind of call you quickly during office hours or at the end of office hours, as opposed to having to wait for another appointment, becomes a huge benefit. So I think in addition to be able to provide, almost equivalent care, I think there's a ton of advantages where telehealth almost outpaces in-person care, because they would have to wait to see you.
Oh, absolutely.
Sorry. Go ahead.
I was going to say with HSS, a lot of patients are coming from far distances, different states, remotely, even internationally. And, before that was a huge barrier to, you getting great follow-up. And now it's all you need is internet access. So it certainly has improved, I think, or it's a good adjunct. I will never say it will replace it. And there are certain things you absolutely need to get your hands on. But it has certainly been a great adjunct to the normal care that we've been given.
That's a great point. I don't know, Joe, I wonder about, and Jay, in terms of literature with regards to your subspecialties, from a shoulder perspective, there's actually some studies coming out now that show that, the telehealth exam versus an in-person exam didn't change management, meaning it was at least equivalent and not inferior, which is what you're looking for when you want to kind of implement something like this. You don't want to take a step back. Anything in the kind of the spine literature to support that? Are you guys finding similar outcomes?
You know, it's still a little bit early. We just, we had actually from HSS have a paper that's just getting published that looks at the physical exam and comparing it to what we do in the virtual exam. And we're actually starting to look at that right now. So I haven't seen a lot yet that's out about what the difference is. But, you know, again, with a lot of spine, people, particularly if it's not a new problem and it's been an established problem, a lot of it is understanding the imaging and seeing how that goes on in the patient. So that ability to be able to look at those images and share those and the coordination is very helpful, which kind of reminds me of the other thing that as Mark was talking about, one of the other advantages here that we probably didn't think was going to happen as much as the coordination of care. And one of the things that we found is, particularly working with the physical therapist, sometimes you'll have a patient who they're with the physical therapist and they want to click in, and if you can arrange it and arrange the time, you can see the patients together. We actually had a patient with one of the spine surgeons that I followed him that had weakness, and we were deciding, did he need surgery? Did he need to come in or not? Because this is the height of the crisis. And we would see him together every week for just a few minutes. But it saved the guy 2 visits. The 2 doctors were on the TV like this right next to each other. And we saw the same thing. Okay, his strength is actually getting a little bit better. We managed him all the way through it. We never even saw him in person throughout the whole thing.
Yeah, it's a great point. I think that's just another benefit of this. This is a question from the audience that I'll put out to anybody. How can we know if a doctor takes telemedicine and if it's covered by insurance?
So I can take a stab. So there's no specific criteria for whether or not you can take telemedicine other than someone sets up the video for you. You know, so if you have a video as a physician, you can do telemedicine. There are restrictions based on state, which we're working through. So there have been restrictions if you have a license in New York State, but don't necessarily have a license in New Jersey, Connecticut, what have you. For your initial visit, the telehealth appointment should be within your state where you are registered as a licensed physician. Beyond that, though, once you establish care, you can do a telehealth visit pretty much anywhere, and then get reimbursed for it. The insurance companies, I believe as of right now, are reimbursing for this. So it's not necessarily, I don't know if everything is at the same level, but they are actually reimbursing for it. So I can tell you, I think most of the doctors at HSS do participate in telehealth to varying degrees. You know, again, there are some limitations in terms of location, but if you're in a state where the doctor is licensed, then yes, it's very possible.
That's great. Joel.
That was one of the early things when this happened. It was March 13th and we started and everything shut down. I think we started the 15th. We had some telehealth that was going on, but it was really very limited because the payment was a big issue. They weren't sure if they were going to pay for it or not. When the virus hit, I think all the insurance companies, it opened up Pandora's box. So everybody, you know, kind of had to move to that. And I think even as the world stabilizes, it's too beneficial of a service for patients, particularly in rural areas, which is where it was becoming more popular even before this. But just, I think as Mark talked about, all the advantages of saving the time and the energy and the travel for some simple things that can be taken care of with it. So it is going to be around, and I think it still will be paid. It may change how that gets done over the next few years as things settle down a bit too, but I think it is here for good and will in general be paid.
Yeah, that's a great point. You know, talking to colleagues elsewhere, a lot of times, you know, insurance companies are reticent to reimburse for things, but they realize, you know, big institutions realize that by kind of decompressing the system with telehealth visits, it frees up resources. God forbid there is another, you know, spike or things like that. So to your point, I don't think it's going away. Jay, and then I've got 2 more questions from the audience, which we're going to get to in a second. But Jay, I had a question that I was curious about. Are there a certain, you know, is there kind of a cadence where you can say, I'll do kind of 4 telehealth visits with the patient and then want to see him in person once, or, you know, can you do everything virtually, or is it condition dependent?
Yeah, so I think it's most certainly kind of condition dependent, and personality individual dependent, right? So, I mean, there are most certainly individuals who do very well independent of actually coming in. There are other individuals who don't do as well. They need a little bit more guidance, a little more help. Then you have sort of these in-betweens where they do fairly well on their own, but they need just little hints here and there to make sure that they're on the right path. So, I mean, those are the type of individuals where sometimes we'll go, okay, the initial eval to kind of maybe get our hands on you, kind of get to know you, see sort of where things are kind of at and how to best sort of assess. So sometimes we'll do that in person, then we'll do a few sessions, sort of telehealth, and see sort of how they're kind of doing, how they're kind of feeling, and what their thoughts are. If they're feeling, you know, I feel like I don't quite get X, Y, and Z, or I've been experiencing pain and symptoms here, and here with certain motions that may not correlate with their initial evaluation, we might go ahead and, all right, let's go ahead and just bring you in. Let's figure out what's going on there. See if we can make the corrections with the motions and kind of get you going again with the telehealth. So, I mean, we have a few individuals that I can think of that are on my caseload where I am seeing them sort of in person, and then they'll go and work on their own and kind of check in with me via telehealth, and we'll take a look at how they're kind of looking and what they're kind of doing, and we'll kind of go in that direction, and they'll follow up kind of in person as needed.
That's great. There are two questions. One I'm just going to answer because it said, how is patient confidentiality being taking place? And it is, you know, I will comment, it's HIPAA compliant. You know, at HSS we use a Zoom interface, which is HIPAA compliant. And so there's no sort of concerns with regards to patient confidentiality from that respect. And that's clearly critical. And it's a great question because that is clearly a concern when you start doing things sort of virtually. This question to you guys, is it possible to potentially record the patient visit, which would then be able to kind of, for the patient to look back on the doctor's diagnosis and feedback, the patient or this attendee feels that it would be great after the fact. Or is anybody doing that now? Is there a role for that, or is just the note that you put in the chart kind of suffice?
I guess what I would say to that is not much different than what I would say to a patient who wants to record the conversation in the room with me, you know, to take it to their family later. As long as I know that they're recording it, I mean, there's nothing I'm saying that I wouldn't say to somebody else, and they're probably saving me a phone call or something like that. So I personally would have no problem with it if they want to do that, as long as I know that's what they're doing. They're using it for communication with their family and things like that.
Yeah, that's a great point. I mean, I think that's how I approach it. You know, it almost becomes kind of a space issue. We can't save every one of these, you know, video visits just from a data storage point of view. But I have the same, you know, kind of approach. And the good news for patients is that, you know, whether it's the video or we all put a very detailed note in the chart after a visit documenting what we heard, what we saw, and our treatment recommendations, and patients are obviously always entitled to get a copy of that as well. So, Mark, where's the future of this going? You know, again, is this, you told me earlier, it's not just a flash in the pan due to COVID. Have we sort of maximized where we're going to be with virtual care? Do you think it's going to keep sort of growing and iterating and get even better?
Yeah, I think it's going to keep evolving. I think that, you know, if the patients continue to give a positive response, which I think most of them have, the convenience aspect, I think, is a huge advantage. And, you know, we've actually talked about this. There's an interesting book out there called The Patient Will See You Now, which talks about how normally patients would wait for a doctor to come see them. And, you know, with the advance of technology and potentially even apps on your phone, you know, I actually had a patient do a virtual visit with me from the front seat of their car, you know, while they were driving to work or someone else. So, you know, in terms of being efficient with your time, you know, if that's one of your goals, I think that this has enormous applications. And so the technology will continue to evolve. We're going to get better at things we need to see in person and things that we can diagnose through telehealth. You know, how to do the workups better, how to do better virtual physical exams. And I think that over time, you're going to see more of a trend. Like right now, I don't know what the percentage is, but, you know, there's a certain percent of our visits at HSS, which are telehealth. And it was a huge percentage during, you know, the COVID crisis and the surge. And now it's certainly less. but I don't think it's going down to 0 or even 1 or 2%. It may settle somewhere in like the 20 to 40% kind of range, where there's a certain number of people that like the advantages of not having to come in and will continue to do that. And as we get better and better at this stuff, we're going to be able to realize that a lot of the workup can be done virtually. I've had at least 3 patients now that the first time I've met them for surgery was in the holding area, because that's, I felt confident in the diagnosis and they were confident in what I was telling them, and we were able to, meet then and, have a successful surgery. So it's certainly an evolving thing, but given where I think the technology is going and, the convenience of being able to literally have your doctor in your pocket, right, in your cell phone, it's hard to beat that advantage, I think.
The other thing, Josh, related to that, without kind of getting too far ahead of ourselves, but this is the tip of the iceberg where we are right now. And we have a whole innovation office at HSS. And one of the things we're looking at in the innovation office is how do we take telehealth to the next step? And we're doing a lot of stuff right now with some different companies that have developed different sensor technologies and things like that. So kind of like the iPhone watch where you can monitor their movements and stuff like that. There's going to be the ability very soon to be able to put something on your forearm and see what your range of motion is and be able to quantify it, looking at strength, looking at your movement. It'll have incredible applications with physical therapy. It'll have incredible applications post-operatively to see how you're doing in terms of some of the strength parameters, how the muscles are firing and stuff like that. So it's kind of like, that kind of futuristic way of looking at it is kind of here and it's upon us. And this is just accelerating it with the ability now, like Mark said, your doctor's right there. Well, all that data is right there that you can share with the clinicians you're working with, whether it's the therapist, the surgeon, or the non-operative people. So the technology is really exciting and kind of fun, where we're going to be able to build on this moving forward.
I think it's a great point. I mean, I've had the same experience where, which was never an option before, unless you kind of left your office and went down to a physical therapy place, if you were lucky enough to practice in a place where the physical therapist and your patient happened to be on that time. But now, calling in, seeing what they're doing. If I have any concerns or the physical therapist has concerns, we have kind of a real-time conversation, as opposed to, a bad game of telephone where I tell the patient, put it on the prescription, and then it kind of gets lost in translation. So I think that what you're kind of alluding to, different wearables and technology advances, the future of this is, again, I think will be, better than what we can do in person. So I think there's a lot of, it's an exciting time. Jay, are there certain things that, just to clarify for patients, certain things that are more amenable, is it to virtual physical therapy? Like, do they have to have had surgery, or is it only for people who've been treated non-operatively, or is it all comers?
Right. So are there certain pathologies that are?
Yeah.
Yeah. So I think a lot of times that it's not so much about the pathology, but more so about sort of the patient themselves. If you're working with an individual who is sort of willing to work, be creative and flexible with changes and maneuver throughout their environment, and really sort of take a proactive approach in their recovery or in the rehabilitation, I think those are the individuals that tend to be best suited for sort of telehealth. I think it's less sort of pathology driven in regards to complexity and making it less optimal with telehealth. So
that's good. I have a question from the audience. Mark or Joel, the question, we mentioned that you can get prescriptions and things like that via these virtual visits. How do you, they want to know how the prescription will be sent to them, during these visits. Do you email it to them? Does it go through the My HSS chart? Does it depend on the patient?
So one of the things that we do is I actually have an office staff member on the visit with me. So I'll have like my nurse or PA kind of be listening in remotely. And as we come up with, a plan, they'll actually email the patient their prescriptions and let the rest of the staff know and document it in Epic. Because, obviously there's the actual visit part, but then you need to document as well. So I actually have someone do that kind of simultaneously. so that they'll get an email by the time the visit is done with all of their prescriptions. And they have access to their chart via the My Chart at HSS. And then they can get their notes right away too.
Yeah. Joel, do you do it in a similar fashion?
Yeah, very similar, because everything is in Epic in our system, our
Record.
medical record, right? Everything is in the EMR. So being that we can send stuff right to your pharmacy, before the conversation is over. If they need orders for anything, it's actually done. You can do it right there as you're talking to the patient, so it's simultaneous.
Yeah, and I think that, was where we started when I had to kind of ask what telehealth is. I mean, those are things we've been doing for a little while now, where you're kind of like, e-prescribing, and all this would fit under the umbrella of telehealth. So I think, patients have already benefited from some of the things that would qualify as telehealth way before COVID. And even kind of, I'm sure we all have friends where, they call me on the weekend and FaceTime and show me something, kind of primitive version of this. And I think we're just getting better, and it's only going to become more and more frequently used.
Yeah, the old version was a telephone call.
Right.
And now there's actually a picture with the telephone call.
We're very Star Trek of us.
Mm-hmm.
So we're kind of starting to run out of time, but anything that you want to bring up that we haven't discussed that you guys think that we should cover?
So I think it's going to change the way that, we manage a lot of like weekend injuries too. So like, as opposed to going to an urgent care center, there are going to be, I think, facilities and physicians available for you to get seen. Like, let's say you hurt yourself playing pickup basketball at the park, someone dials the phone up, and there's going to be someone there to help kind of guide you through the next few steps. Is kind of how I see this evolving. There's so many apps out there, and not that there's a doctor app just yet or PT app just yet, but maybe in our lifetimes.
No, that's a great point. I mean, and that, it's because I just alluded to that, we all do that on the weekends for sort of friends and stuff. And ironically, this becomes a much better, safer way. There's a chart. It becomes a real appointment. It's not this sort of off the cuff thing. So I think medical legally, it's a better way to do it. But you also, you can start a patient's workup on a Saturday. You almost have the MRI authorized by the time it opens on Monday. So I think everything about it just sort of increases efficiency, provides care more efficiently, which hopefully leads to better, outcomes for patients.
Yeah.
Jay, what percent of your visits now, like kind of target, obviously COVID was different, but moving forward, what percent do you think are going to be kind of virtual versus inpatient, or in person, I should say?
So I would speculate. I mean, we are shifting. The entire rehab department itself is shifting, sort of incorporation of the telehealth. So a lot of the times, like certain individuals, post-operative total knees, total hips, it was very selective in regards to who would receive telehealth. Now, as an entire department, we're starting to shift that thought process to actually the opposite direction. So we're actually encouraging more of the telehealth post-operative, as opposed to sort of in-person or visiting. So I think going forward, as far as like personally my caseload, I wouldn't be surprised if it going forward was somewhere between 10 to 20% telehealth. But I think as a department as a whole, since the whole telehealth and the COVID pandemic, because we were doing telehealth prior, but some stats came out when we were looking at things, and it was something like a 2,000% increase in telehealth visits across the department. So I wouldn't be surprised if telehealth, I mean, it's going to stick around. We have colleagues who actually that's now their entire role is just telehealth, 100% of their caseload.
Joel, I was going to ask you, like, what's your ultimate goal for telehealth in terms of like a practice breakdown versus seeing patients in person versus telehealth, and how would that differ for new patients versus follow-ups?
I think what it comes down to is, the patient and the problem. And I think we're seeing it kind of settle into, I think, as Mark talked about before, it's right around 20% for our entire department, which I think is really close to what it is for the entire institution. It's been very stable as we've kind of ramped back up everybody's practices again. They're getting closer to what it was in the pre-COVID days. That 20%, it's efficient for people. These are people that are willing to come in but there's maybe they just, the transportation broke down that day, whatever. There's a lot of nuances where it's just going to be more convenient. So I think that 20 to 25% is going to be a number that's going to be useful and helpful for people, where it's going to settle out at, but people will go between the two. It's not going to be that you're only a telehealth patient or you're only a in-person patient. I think people are going to go back and forth, and that's where I think, as we talk about people that you have established relationships with, it's going to be easier to do the telehealth with them because you know them and you've seen them, and you know when things aren't going exactly right. And there's so much, the communication is so much easier because there's been that relationship that you've already built.
I think it's a great point. Personally, I typically, if I operate on somebody, I'll see them about a week or two after surgery, 6 weeks, 3 months. And now for a lot of people, the 6-week visit, where I usually just have them come in, take them out of their sling and say, start more aggressive physical therapy. And I'm not even doing much because I don't even want to stress the shoulder too much. That's become a perfect telehealth visit. Patients are happier. You're not missing out on any care, nothing slipping through the cracks. And that's that, 20 to 30% right out of the gate, visits that we'll be able to kind of, do. So I think, yeah, I agree with those numbers. There was a quick question from the audience again. How does it work for pain med prescriptions? They asked, pharmacies seem to require original hand signed prescriptions. Maybe I take that or you want me? Yeah, it's actually the opposite. The days of handwritten prescriptions have kind of fallen by the wayside. We now almost have to e-prescribe it unless we have an extenuating circumstance. So I think that's really not a concern. Do you disagree or?
No, totally.
Yeah, so I would say is that, we have to do an e-prescribe. You're also supposed to check iStop in New York State, which is a history of someone's narcotic usage. And ultimately, I don't know how you guys feel, but we're trying to decrease the amount of narcotics that we're prescribing patients. So for me in particular, I'm really just prescribing them for post-operative patients where I have already established a relationship with the patient. It's almost never for a new patient visit, because that I think would not be the most appropriate thing to do. But certainly for my post-ops and follow-up patients that I have known for a while is where we'll prescribe.
That's great. So
I think that's fair. Yeah, I don't know if anybody at HSS would prescribe opioids for a patient that they've never seen before, and a virtual visit is the first visit.
Agree, totally agree. And I wouldn't even know where to find my prescription pad at this point. It's almost all virtually. But so I digress. So we're actually kind of at the time limit, but I want to thank all of you for your time and insights, because I think we're only going to kind of having more of these because it's going to become more and more popular. And I think we did a great job of kind of highlighting to patients that virtual care or telehealth is really here to stay. I think it's available by most doctors at HSS. And the patients need to realize that, look, not every condition is sort of amenable to being treated this way, but a lot of them are. And I think we're going to get more and more sophisticated about the patients that are going to respond well to these types of visits versus those that still need to be treated in person or occasionally come in person. So I want to thank you again for tuning in, all the participants, and for the great questions, very thoughtful. And I think it helped spur some good conversation from us. I want to thank Joel, Mark, and Jay. All of you have really done a great job implementing telehealth and virtual care into your practice, and we've really benefited from that. So thank you.
Thank you.
Thank you, Josh.
Thank you.
If this will be posted on YouTube for the participants, so you can comment there and visit hss.edu for more information on telehealth and telemedicine options at HSS. All right. Thanks, everyone.
Yeah.